Good afternoon, everybody. Hope you enjoyed your lunch. I know it's always harder to get first speakers out after lunch, but we'll do our best. And I'm Mavis Johnson, part of the CARSP group, and I'm very happy to be moderating this session. Following on the first speed management session this morning, these are 3 additional presentations about the topic. And so without any further ado, I'd like to invite Bryce Batomen to come to the microphone. Bryce is an epidemiologist. He's affiliated with the Darla Lona School of Public Health, the University of Toronto. He's an incoming assistant professor at the University of Toronto. And he's going to present his postdoctorate project performed at the INRS in Montreal. He's interested in trauma care, road safety, and methods in epidemiology and research. So thank you, Bryce, if you would come and take the floor.
Good afternoon, everyone. I know we just have a wonderful and amazing lunch, and it's a little bit perfect. So we just have an amazing lunch. It's a little bit frizzy, so I will be fighting against postprandial grossiness, but I will try to make it a little bit fun. So my name is Batomen, and today I will present about the impact of traffic calming measure on road traffic, collision, and injury. That's not changing. I have no actual or potential conflict of interest in relation to the content of this talk. And we all know that road traffic collision are a leading cause of premature death. As with most public health issues, road traffic deaths are just the tip of the iceberg. Injury caused by collision represent a preventable burden to the healthcare system. And with more than 80% of North Americans living in city, this put a lot of pressure on city in order to have like sustainable road transport system. In that context, the implementation of traffic calming measure is essential for speed management and play a central role for Vision Zero plans that many cities are adopting. So what is a traffic calming measure? Consists of physical modification of the road network. I don't know, with my little face, I'm kind of hiding some of illustration of the traffic calming measure. So in the top right, we have a curve extension. In the middle, we have a raised roadwork, and below we have a speed bump, just to give an illustration. So traffic calming measures generally aim to either reduce the vehicle speed or to reduce the traffic volume, or both. And there are several strategies structuring the implementation, but we can summarize them in 2 approaches. We have what we call the isolated approach, where measures are installed at specific point on the road network. And you have the area-wide approach, where measures are installed in a systematic and integrated manner within a geographic area comprising several streets. And when we look at the literature, there are several studies that look at traffic calming measure in isolated approach, and there are reported reduction in collision and injury, even death. For the area-wide approach, a meta-analysis suggests a 15% reduction when we talk about injury for the entire calm area. But when we look at collision, pedestrian collision, and all fatality, the result was inconclusive. However, some of this study has been criticized due to their pre-post design, which sometimes cannot account for the underlying trend in the number of collisions. This is problematic because with the isolated approach, for example, we tend to implement traffic calming measures in places where there was a high number of collisions. So as places that register an abnormally high rate of collision tend to regress with time to 1 on average. So this can bias the result. This is what I just described is the regression to the mean. You also have the issue of collision dispersion because in an urban context, collisions are generally dispersed, so at multiple points of the road network. So by only implementing traffic calming measure at a specific point, we are only talking like a small proportion of all collision in the city. In addition, in the literature, there was very few studies based on Canadian data. So that's why the objective of this work was really to extend the methodological rigor of previous study and trying to assess the effectiveness of traffic calming measure on road traffic collision, injury, fatality using a longitudinal design. So the study was conducted in Montreal City using data from 2012 to 2019. And we include several traffic calming measures. And the figure you saw there is like a picture of Montreal. And each line represents a road segment. So the issue in Montreal is that the decision on where and how to implement traffic calming measures depend on municipality within the city. So to perform our study, we really need to have data on the when and where. So for that, we needed to collaborate with municipality within the city. So the road segment in Dre, road segment within municipality, where we were enabled to like build a collaboration to have the data on the when and where. And the road segment in color is where we really have data to know when and where traffic calming measures were implemented. So the road segment in green and road segment where at least one traffic calming measure were implemented during the study period. And the other color, the color which is like lightly yellow, is where there was no traffic calming measure. So when the study started, when we started in 2011, there was around 100 traffic calming measures in place in those municipalities. And by the end of the study, we have around 1,700. And half of traffic calming measures implemented was speed bump, and a quarter was curb extension. And one of the key findings here is that almost 3/4 of all traffic calming measures were implemented in local road. And when we look at collision in the same municipality where we have the data, overall severe collision was decreasing. By severe collision, we mean a collision where at least one victim has been hospitalized in the next 30 days. But the number of fatal collisions remained fairly stable. But in contrary with traffic calming measure, more than 60% of collision with fatal, 16% of fatal or severe collision were on arterial road. But traffic calming, almost 3/4 was on local road. So we already see that there is a discrepancy here. So my picture is a little bit hiding my causal model here, but we decide to focus on 2 units of analysis, intersection and census tract. Intersection because more than 3/4 of severe and deadly collision occur in intersection. And an intersection was defined as exposed if that intersection was within a 50-meter radius of any traffic calming measure. So to really isolate the green line in this figure, which is the impact of traffic calming measure on collision, we need to account for time fixed characteristics that are both associated with traffic calming measure on collision, the underlying trend, time varying characteristic, and other non-measure characteristics. So I first start by collecting data on how wide is the intersection. Those the intersection is close to a school, metro station, bus stop. Then I realized that if I want to collect all those variables and adjust for that, I'm making huge assumption about the quality of the data, how to specify those variables in the model. So I opt for what we call a self-control design. So I was comparing each intersection against itself. So by doing that, I'm removing the majority of arrow going into the traffic calming measure. But there are still 2 problems, the underlying trend. By adding here as a covariate in my model, I'm taking into account the underlying trend. There's also time varying characteristic, so change that could change over time that the year variable we have to take into account. However, one of the main assumptions that this type of model make is that observations are independent within and across strata. So in other sense, intersection are independent of each other, which is not the case because if an intersection have a curve extension, all the intersection around that intersection might be also impacted by that intervention. So in order to account for that, I had a random effect. So it's just a way to say to the model, I know that if intersections are close together, they might share some characteristic, and I want those random effects to capture those characteristics, and I allow those random effects to vary by year too. So for that, I use a Bayesian implementation to compute incidence rate ratio. So all the Greek letter you saw below there is just to perform what I just explained in Word. So I will show the result, focusing with the result at the intersection level. So first, when we look at fatal and severe collision, this figure here shows the range of possible value of the incidence rate ratio that are compatible with my data. So the dashed vertical line indicates the null value. So if you are in the right, if my right, on my right is like reduction of collision. If you are on my left, it's like increasing of collision. So when we look at all intersections, the data was compatible with like a 12% reduction in collision, but there was also a little bit compatible with small increase. But I just remember I presented that traffic calming was mostly implemented on local road, while fatal and severe collision was mostly on arterial road. So by performing stratifying analysis, looking at arterial intersection, defined as, given that intersection could be made of many roads, if one of these roads are arterial, I will define the intersection as arterial, and the other intersection will be local. And when we look at stratify analysis, we observe that with arterial intersection, we don't see that much effect, but with local intersection, we see a huge effect. So this suggests that traffic calming measures work where they are implemented. So also look for car injury, for car occupant injury. The results seem to go in the same direction, but with low number of events, the uncertainty is a little bit large. But for pedestrian, there's not that much effect. So we can really say a lot because the uncertainty is more large. So we need either it's not working, either it's just we need more events because we're focusing only fatal and kill and seriously injured pedestrians. So it's very low number. So at the census tract level then, I have some indication of reduction too, very slow. And this might be, but I cannot say in confidence that traffic calming measures work. The issue there might be that in census tract have a mix of local and arterial road. So maybe the effect that I'm observing on local road is diluted when I look at more large spatial area. So this seems to be the message here. So this study have some strength because the self-control design with the random effect to take into account all the issue I mentioned, but I still have limitation. For example, missing data, even in the municipality where we were able to collect the data, for 9% of traffic for road segment, of traffic calming measure, I know the where, but I didn't know the when it was implemented. And measurement error. I'm using severe and fatal collision to reduce underreporting, but it's still a possibility. And also the collision data is coming from city open portal, police report. So if the police is telling me that the collision occurred here, where the collision occurred, I don't know, 200 before or after, this could create bias in my analysis. So in conclusion, I will say traffic calming measures might reduce overall fatal or severe collision on local road intersection where they are more implemented. But we do need better data on traffic calming implementation as well as traffic volume, because the volume wasn't included on this study, and we know that the traffic calming can also change the distribution of road user. And with that, we can perform better, robust assessment of the impact. And this is important because traffic calming measures are part of Plan Social Vision Zero, which aim to enhance safety and promote active mode of transportation. So I would like to thank all the collaborators on this work and the funding agency. So thank you, everyone. And I'm looking forward for your question.
Thank you very much, Bryce. We're going to save the questions till the end. And if you're looking at the order of presentations, we're going to have just a slight change because we do have 2 in-person presentations and then we have a pre-recorded presentation. And my observation about the attendance at this conference is that we do have a lot of public health representatives here. And that is not a sudden change, but it has been growing. And I'm just so impressed with the number of people who represent that. And, 10 years ago, if we had had a session on speed management, and especially automated speed enforcement, I had no doubt we would have had at least 3 or 4 police officers in the audience. And yet I think I've only heard from 1 throughout the conference. So things are changing. And I think we need to get our police officers back to this group. But I think in general, they're moving in the right direction. So thank you particularly. And so I'd like to welcome Zubair. And he graduated from the University of British Columbia, and which I'm very pleased with a master's degree in human nutrition. He joined the Hospital for Sick Children in 2021 with Child Health Evaluative Sciences. And today he's going to talk about evaluation of an automated speed enforcement program in Toronto, which again is a really broad picture of from a public health perspective. And I certainly appreciated Andrew's presentation this morning. So we welcome you to the presentation.
Thank you so much, Mavis. Hi, everyone. Thank you for joining us here today. I'm going to present some results of our preliminary analysis on an automated speed enforcement in Toronto. Sorry, the next. At first, I would like to thank our amazing research team who are present here and who couldn't make it to this conference, and as well as the transportation services of the City of Toronto. We know that higher vehicle speed is associated with an increased risk of severe injuries and fatal collision. The City of Toronto's Vision Zero updated road safety plan aims to eliminate serious and fatal injuries from the roads of Toronto. This plan is also known as Vision Zero 2.0. You might have known about it. And this Vision Zero 2.0 road safety plan identifies children as one of the most vulnerable road user groups. And the city has initiated several strategies to manage speeding, and automated speed enforcement program is one of the plan strategies to manage speeding as a part of Vision Zero 2.0. So an automated speed enforcement is an automated system that consists of a camera unit and a speed measurement device, which we can see in this picture here. These are mobile units, which means this can be moved from one place to another. These units measure the speed and capture the license plate of a moving vehicle. To manage speeding and to allow the municipalities of Ontario, the province of Ontario passed a Safer School Zone Act in 2017 to allow the municipalities to address speeding in the community safety zones near schools. And after this bill, the City Council have passed necessary bylaws to designate school frontage areas as community safety zones. And the city has initiated automated speed enforcement in 2020 January, and our team is collaborating with the city to evaluate the effectiveness of automated speed enforcement. So in total, we have 50 mobile units. 2 mobile camera units are allocated in each of the 25 wards in Toronto. In total, we have 6 rotation phases. So at the end of this program, we will have a total of 300 locations. So each of these phases, phase rotation cycle has a warning period of approximately 90 days where regulatory signs will be posted to inform the drivers about the upcoming changes. Then the AAC camera units will be placed and the ticketing will be started. And after the end of 3 months of ticketing, the camera units will be placed to the new locations. And while the first phase of ticketing will be occurred, the second phase of location will be selected and the warning signs will be put while the first phase will be ticketing. This was the initial plan. However, during this time, the COVID-19 pandemic restrictions started and some of these phases have been delayed. So now we have 3 to 6 months of ticketing period for each of these phases. So far, 3 phases have been completed out of 6 phases. And in this map, we can see that these locations are scattered across the city. All of these wards in Toronto have received AAC intervention. These cameras were placed near a school in the community safety zone areas. Due to time limit, I'll only be able to present results from the first phase of this program. So we have compared vehicle speed during the AAC program to pre-AAC period time. The pre-AAC period vehicle speed and volume data were collected using a pneumatic road tube by the City of Toronto in the year 2018 or later. And during AAC period, vehicle speed and volume data were collected by the AAC camera devices. For outcome variable, we have looked at the percentage of vehicles speeding over the speed limit. In the phase 1, we have 30 km/h speed limit roads and 40 km/h speed limit roads. We have also looked at 85th percentile speed, which is heavily used in traffic design and road safety. In this slide, we are seeing the percentage of vehicle exceeding the speed limit in the phase 1 of this program. As we can see that the percentage of vehicle exceeding the speed limit during the ticketing period has reduced compared to the pre-AAC period and warning period in both 30 and 40 km/h roads. An interesting observation is that the percentage of vehicle speeding over the speed limit by more than 10 km/h, which are the yellow, orange, and red fragments in this bar plot, reduced more during ticketing compared to pre-AAC and the warning period in both 30 and 40 km/h roads. This slide shows the percentage of vehicle exceeding the speed limit by day during the warning and ticketing period of phase 1 in 40 km/h roads. As we can see as we have seen in the previous slide, the yellow, orange, and red fragment reduced more during the ticketing. And at the start of ticketing, this percentage reduced drastically around July 6th. And it continued to drop over the period of time, as we can see here, until the end of ticketing period. And this slide was for 40 km/h roads, and we have similar results for 30 km/h roads as well. Here we are seeing the 85th percentile speed during the AAC warning and ticketing period and the pre-AAC period. Some of this road have received an additional intervention, which is the reduction of speed limit. The previous speed limit is denoted by the red circle in this graph. And the current speed limit are denoted by the green circles here. And all locations except one, I think this one, the 85th percentile during the ticketing was reduced compared to pre-AAC period and the warning period of this program. And not surprisingly, the higher reduction occurred in the roads, which where the speed limits were reduced. This slide shows the 85th percentile speed by its location in all three phases during the ticketing period, which have been completed, and fourth phase is now undergoing. The size of this circle represents the speed limit of these roads near schools, and darker shade of red means a higher 85th percentile speed. And as we can see that outside of downtown core Toronto area, we have a higher speed limit roads as well as higher 85th percentile speed. And this is not surprising as well, because these roads has higher speed limit, and this has more complex network of arterial and collector roads. So we have conducted a robust analysis of comparing speeds during AAC period to pre-AAC period. However, our study has some limitations. We do not have pre-AAC period data for all of the locations where the AAC cameras are placed. For example, in the phase 1, we have 37 locations. In the phase 2, we have 42, and in the phase 3, we have 44. The city has collected some additional data where such data were not available prior installation of the AAC camera. And all of these three phases that have been completed so far has some sort of COVID-19 pandemic related lockdown and school opening and closure at that time. And we do not know how this might have impacted drivers' behavior regarding speeding, particularly when children were not present in the schools. So we have seen that the percentage of drivers speeding over the speed limit and 85th percentile speed dropped during the AAC period compared to pre-AAC period. And however, there are some locations where drivers are still speeding over 50 km/h in some roads, and these are mostly suburban Toronto areas where speeding can be potentially dangerous for child, pedestrian, and other vulnerable road users. In conclusion, from our very early preliminary results, we can say that AAC can be an effective strategy to manage speeding, and it can be worked with as a complement with other Vision Zero 2.0 strategies that the city have been taken, such as geometric road design improvement, reduction of speed limit, improved public education, and enhanced police enforcement. As for our next step of our research, we have collected some additional data from phase 3 location prior to the installation of the AAC camera units, which will be utilized as control sites. We will be conducting a multivariate statistical analysis, controlling for season, type of roads, and built environment changes. We will also look at, we will also conduct analysis stratified by month to understand the effect of AAC over time. We have some additional data collected after the AAC cameras were removed, which will be, which will help us to understand how speeding changes after AAC cameras are taken away. Thank you so much for listening.
Thank you, Zubair. And we'll be, after this next presentation, we'll be asking the presenters to come back here and we'll take questions at that time. And so I do have some limitations in introducing our next presenter because I don't have a bio. If this person is listening, I hope he might introduce himself. Sorry. Oh, please. You say, and you can say what you like. sorry, I just haven't got a bio for him, so please go up here and introduce him. The floor is yours.
So Tate HubkaRao is a PhD candidate at the University of Calgary studying epidemiology, working under the supervision of Dr. Brent Hagel. He completed his Master's of Science in Australia before returning to Calgary. He has worked as a research coordinator, project coordinator for the CHASE study across Canada, as well as CIPRC teams, and very much involved. And he is now doing a stepped wedge randomized control trial, working closely with the team at the City of Calgary in that municipality.
That's amazing. Thank you very much for that.
Hi, everyone. I would first like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, Canada, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The City of Calgary is also home to the Métis Nation of Alberta, Region 3. Walking and bicycling is great for us. It can improve our physical and mental health, reduce our risk of cardiovascular disease, and it can also have an impact on our communities, economies, and environment. Unfortunately, over the last few decades, the proportion of children walking or biking to school has decreased substantially, while travel by motor vehicle has increased. With over 70 children killed each year in Canada while walking or bicycling, both the actual and perceived risk to children during active transportation are way too high. This risk may in turn influence parents. And out of concern of these injuries, parents may switch to driving their kids to school rather than walking or biking, further increasing the risk of injury for those who are still walking or biking to school. While there are many reasons for the high risk of injury and fatality, motor vehicle speed is predominant. Not only does a increase in vehicle speed increase the probability a collision will occur, it can also increase the likelihood that a collision will result in death, commonly visualized by figures such as this. In order to reduce the risk of pedestrian and bicyclist deaths in our cities, we need to find effective ways to reduce the speed of vehicles, especially at locations of higher child activity, such as around schools. One way of doing that is by making physical changes to how our roads are designed, such as with traffic calming measures. This can signal to drivers that high speeds are not safe for them, encouraging the drivers to slow down to a speed that's more comfortable. Traffic calming can decrease vehicle speed in a few different ways, including by narrowing the width of the roadway, such as with the use of the traffic calming curb, which is the image on the right, or by creating horizontal deflection that a driver has to avoid, such as an in-street sign, which is the image on the left. These measures can adjust the speed at which drivers feel comfortable driving, but can then decrease it to a level that we actually feel safe walking and biking, and that we actually see increases or improvements in safety. To look at that, this study used a modified step wedge design to compare the effectiveness of two traffic calming measures at reducing traffic speed and volume and increasing walking and biking around elementary schools in Calgary, Alberta. These traffic calming measures included the in-street signs and the traffic calming curves, which we showed on the previous slide. So as part of this study, we had two different analyses. The first one looked at the outcomes from before compared to after installation of the interventions to see if a significant change occurred in traffic speed, traffic volume, or active transportation prevalence. The second compared these outcomes from the pre and post time immediately following installation to a 6-month follow-up to investigate the longer-term trends and see if these changes that we first saw in the first analysis were actually held constant through this longer term. Our first step in this study was to identify eligible elementary schools in Calgary. Out of the 364 total public schools, we excluded those that had higher than grade 9, included special programs, did not have an intersection within 100 meters of the main entrance, had other studies going on, or already had the study interventions installed. Of the 109 eligible schools, we randomly selected 52 to receive one of the two interventions during a specific week within the study period. Only 52 were selected due to logistical limitations in being able to collect data. We just couldn't collect it at any more schools. For some context, all schools in Calgary have a 30-kilometer speed limit between 7:30 a.m. and 9 p.m. All the data that I will present was collected within that window. So this study started in July 2020 and finished in May 2021. We first collected a week of pre-installation data, which is shown by that first box filled with an A. The week following that, we had one of the interventions installed at each school, so either the traffic calming curb or the in-street sign. And this is indicated by the second box with a B in it. The third week, we then collected another week of post-installation data, shown by that third C box. A small gap in data collection was scheduled at the end of August to separate the weeks where class was not in session, which is in July and August, and the weeks where class was in session, so September and October. Schools that were visited in the fall were again visited in the following spring, which is shown by that final box with a D in it. For the traffic speed and volume data, we were able to collect up to a week of data at the pre-installation, post-installation, and follow-up points. While for the active transportation data, we were only able to collect a single day at each of those points. This is due to logistical and financial limitations again. So these photos show a Google Maps view of a couple of the intersections in the study. So the photo on the left shows an intersection where a single traffic calming curb, that yellow oval, was placed on either side of the marked crosswalk. The photo on the right shows an intersection that received an in-street sign. And although you can only really see the shadow of it, it is placed along the median line in front of that crosswalk. Traffic speed and volume data were collected using time-marked pneumatic tubes placed across the road approximately 30 meters from the intervention, which is shown by that dual black line at the top of each image. And the number of people using active transportation and the mode of travel were recorded on video using a mile-vision camera as they crossed the street at the intervention site's crosswalk. So these are placed where that red circle is and focused along the direction of the dashed line. So now into our results. For the first analysis, looking at the pre versus the post-installation outcomes, we used a linear mixed effects model. So speed before and after installation was compared, stratifying by intervention type, so either the traffic calming curb or in-street sign, and direction of travel, so either towards or away from the intervention. The season, summer or fall, and the school themselves were considered random effects. Data were aggregated by time period. So morning was classified as between 7:30 a.m. to 9 a.m. Class time was from 9 a.m. to 3 p.m. and afternoon was from 3 p.m. to 5:30 p.m. Results suggest that a statistically significant reduction in speed occurred at locations that installed an in-street sign, regardless of the time period or direction of travel. At locations that received traffic calming curbs, reductions in speed were only observed during the morning period for drivers moving towards the intervention. For count data, a negative binomial mixed effects model was used, with season and school as random effects similar to the previous analysis. For vehicle volume, no significant changes in the number of vehicles passing by the school were observed regardless of intervention. And while we only have a small amount of data for the active transportation counts, preliminary findings indicate a decrease in the total number of people using the intersection at in-street sign locations. This is a slightly different time period, though, as it's only 1 hour rather than the full morning time period. For the second analysis, main analysis, looking at determining whether changes lasted longer term, we use the same analysis, but now including that follow-up data. So these results suggested a longer-term decrease in speed during the morning time period for those driving towards the intersection regardless of location. A significant decrease in speed during the class time was found for those driving away from the intersection at traffic calming locations, and a significant decrease in speed in the afternoon for those driving away from in-street sign locations. During all other times, we found no evidence that speed was significantly changed. And for the vehicle volume, a longer-term decrease was only observed during the class time at in-street sign locations. For the specific analysis, active transportation counts were not yet complete enough, completely entered, and so I can't show those results quite yet. So overall, our main findings following installation indicated a significant reduction in vehicle speed of approximately 1 km/h was found at in-street sign locations, regardless of time period. No significant changes were found regarding vehicle volume, and early active transportation results suggest a reduction at in-street sign locations. For the follow-up analysis, long-term analysis, some continued reductions in speed were observed, with a reduction in volume during one of the time periods. So strength of the study was the use of the modified step wedge design, allowing us to randomly assign interventions to schools and directly measure our outcomes before and after installation of the intervention. Unfortunately, due to logistical limitations, we were not able to collect data on an ongoing basis, similar to more traditional step wedge designs, limiting our ability to causally link the intervention to the reduction in speed. Our partnership with the City of Calgary was a considerable strength and was the reason for the study being possible. So if anyone is interested in more detail on how that partnership worked, please reach out to me. Another strength was that the interventions we use can be temporary and that they can be easily removed. So the in-street signs were bolted in, but can be unbolted easily, while the traffic calming curves are basically just set in place with a crane and can be removed with a crane as well. They're not bolted in. So this allows us to visit more sites as the cost of each intervention is lower. This also allows the city to evaluate each site independently and transition to the sites to a more permanent version if so desired, moving the temporary features to new sites and improving traffic safety throughout the city in an ongoing fashion. While this study was collected during the COVID pandemic, changes between the pre and post installation are expected to be similar to non-COVID times, as we're not really looking at overall volumes, but just the change in volume from previous post. Going forward, we intend to complete the analysis of the active transportation data, including separating out adults and children from the total number and analyzing counts during those same 3 time periods at vehicle speed and vehicle volume. While the results indicated a significant reduction in speed at in-street sign locations, the reduction was only about 1 km/h, which may seem a small change. The good news is that we were able to still observe that change while the speed limit itself was only 30 km/h. So should the same interventions be used in the same way in locations with a higher speed limit, we may actually observe a greater reduction in speed and hence a greater improvement in road safety. So future studies would be useful to detail the degree of speed reduction in these higher speed limit areas, or if these interventions have different influences on driver speed depending on the posted speed limit. So that's all for today. Thank you so much for listening, and thank you to all my colleagues who make this happen, as well as my funders. If you do have any questions, you can contact me either through Twitter or my email. Thank you very much.
Thank you. And there were 3 very interesting presentations. If our 2 presenters that are here would like to come up to this stage, so perhaps we could have some questions or a conversation. Okay. So thank you. Does anyone out there like to ask a question, either specifically or generally about what we just heard? There's microphones. Oh, there.
This one should work.
Thanks. Those were both great presentations. Bryce, my question's for you. In Quebec, are all traffic calming measures implemented on a permanent basis? Because I know in some municipalities, they put them in temporarily just to make sure that they work and they pilot them for a bit. And then they take them out for winter maintenance. But we know a lot of the collisions are happening in those winter months. So there's just a bit of a discrepancy there. So I'm wondering if you looked at temporary versus permanent measures at all.
Thank you for your question. we aggregated data at yearly time space. So we try to focus on curve extension, speed bump, which are difficult to put and remove. So other traffic measures that will easily remove, we did not really consider them in the analysis for that issue. But data was aggregated at the time unit. So it can be a bias, true, but within by design, we reduce the issue.
Andrew, did you have a question? Linda?
No? I'm not sure if I've got it 100%, but it seems there's some differences in the findings of the different studies in terms of whether traffic calming are effective. Bryce, there wasn't really much of an effect. Is that the way I read it? I'm just wondering if there's some, in terms of the methods, that we heard about 3 very different methods of, well, one was ASE, but traffic calming between nerves and tates. And if you have any comment about how the results may have differed and why, because a lot of our past studies have shown quite a strong effect of traffic calming.
Yes, thank you for your question. I don't think the study are in contradiction. First, I was focusing on several and deadly collision, while in previous study, mostly people include all collision. So this can be one reason. Also, I work at larger spatial unit. I include more area of the city than previous study. Previous study were mostly looking at couple of street road segment. There are some that also look at wide, but previous study was more restricted. And overall, I don't think my result is saying that it doesn't work. My result is suggesting that it works where it is mostly implemented. So this is my conclusion, and I did not include other measure like ASD wasn't included.
Thank you. I think this question might be for either or both of you, and it might be for anybody else in the room as well, because I think both of your presentations are pointing towards a problem that I'm not sure we have a solution for. Toronto and Montreal have got areas where we've got these typically 60-kilometer-an-hour arterials to which traffic calming doesn't apply, to which speed reduction or speed enforcement might only apply intermittently, and also where even facilities for pedestrian crossing may not occur at distances that correspond to the average length of the average village, if that. So we seem to have some unsolved problems. And it's those unsolved problems that you both point to as, hey, we've got this halo of fast cars, or hey, we've got this halo of severe and fatal crashes. So what are we going to do? Like in Toronto and on Montreal Island, what are we actually going to do with those roads?
Thank you, Andrew. Yes, I mean, like if we have a higher speed limit for any road, that would mean that the vehicle will be crossing at higher speed, and those can be potentially dangerous for vulnerable road user groups such as children or older adults. What to do? I think like our research shows that there is an issue of speeding in some areas. We have to I think up to the decision makers, like how to utilize and what sort of like preventive measures they would like to take from this data-driven research. As I think like only one intervention might not be working to reduce speeding, so that might mean like we might have to see and what intervention would work to reduce speeding, and also to know like whether these roads are actually unsafe for pedestrian, and is there any other ways to deal with that issues like about regarding crossings and those things. But if you would like to add.
Yes, I would like to compliment. So true that both the studies are suggesting something is happening on arterial road. So ASC seems to be a promising avenue. So we need more with the data is present, I think there is a potential to do like use robust methodology to identify a hotspot period during day. So I could imagine a study where we can compare chunk of hour between day. For example, we compare a Monday morning to the Monday morning of next week and the Monday morning of previous week, and going in a time series approach to see, okay, overall the speed is decreasing, but where are the period of the day where we don't see that much decrease? What can we do? And maybe for some specific area, I don't know, maybe a more permanent ASC or random police presence that in hotspot day, a mix of this type of approach, because I think with the studies suggest that the type of traffic calming we are evaluating work, but they are not suitable for arterial road. So this will be one of my future study to perform using the amazing data he present.
Anyone else got a question? I'd like to ask one, and I guess it is about traffic calming measures such as speed humps and other types of traffic calming measures, but also about automated speed enforcement. Have you ever found that drivers change their routes because they don't want to go down a street that's traffic calmed, and so perhaps we move the problem to another street? But anybody else got a comment to make about that? Is that drivers perhaps change their traffic patterns?
It depends on how the traffic calming measure is implemented. When the city or the municipality follow an isolated approach, it's easy for the driver to change. But for neighborhood in Montreal, like Le Plateau, whatever street segment you will take, you will face a traffic calming measure or you will face a one-way. So at one point we'll be, okay, I will support that speed bump, or I will support that, I don't know, lane reduction. So it really depends on how the traffic measure is implemented. If it's just like, okay, oh, the last year there has been 5 collisions here, I will just put a speed bump there, but all the other street, I will let them like, without intervention, we might end up with that issue that I call collision dispersion. And this is also another reason why we need good data on speed and volume to capture that, and to be able even to perform prediction strategy to anticipate how the volume might change. When I say volume, it's not only driver, pedestrian, cyclists, all that. So I would say we need better data, not that we don't know that the speed is the problem, but to better anticipate how the user, because it's a dynamic system, how the user will interact. I don't know if you want to.
I would like to add to that regarding AAC program. So we have data collected before the AC cameras were implemented in some locations. So we also looked at the traffic volume and speed data, along with speed data. But it's hard to say whether drivers would actually change their routes, whether they know like there is some sort of like enforcement happening on this route, so they would take another one. And regarding the volume data during the pre-AAC and the AAC period, it's actually all across the places. Some places had a higher driving traffic volume and some places has lower traffic volume. In some locations, the speed limit has changed, so that might have something to do with these changes. So there is all sort of like different data and different variables that are coming into play. So it's very hard to say, but that would be logical for a driver if someone got a fine to speed in a road, they might change the route or they might reduce the speed. I think that's also a part of the not public education, but as a part of enforcement. That's what I think, but yeah, thank you.
Anyone? Oh, right.
I've heard a lot about speed management today from various speakers. Obviously, it works. It's being applied around schools. Certainly it is in Ottawa. Why can't we have this more widely? Why do politicians balk at the idea of implementing widespread automatic speed enforcement? Yeah, the public says it's a cash grab, Well, put the cash back in to road safety and speed enforcement. So they can't say that it's a cash grab. What's stopping us from doing that? It is a proven method and it saves lives. Maybe a panelist could speak to that, but maybe there's others who spoke earlier who would like to comment on it as well.
Well, I have a comment, and I agree. And I think what I heard from the City of Ottawa was automated speed enforcement this morning, where that the revenue is directly refunded into investing, and I'll use the word investing in road safety rather than just spending in road safety, but investing in recognized programs that are going to continue to make a difference in other places. And I think, like many other road safety programs, it comes down to political will. If you've got a councillor that's a forgiving, a person that's really truly believes in this, we need to get them speaking out, because certainly in all the years that I've been working in this, it all really bottoms out at political will. Yeah. You broke it, Brian.
Oh, it's working good. So maybe I can't do this one without sounding a little bit self-serving, but the other way that that has been applied with drink driving programs in some places in the United States is tremendously clever, because you don't just put drink driving into prevention, but you also make drink driving pay for the local trauma hospital and the local trauma system. And you put up billboards saying, you know, we're collecting enough money from impaired drivers to pay for our trauma hospital. Really? It costs that much, and I'm going to pay for it that way. So if you're targeting road user behavior, there's a variety of things that you can do with these self-paying things to balance things out. I would like that to be appealing to the politicians and the population, and I think we have to keep on feeding them, you know, good ideas without sounding too self-serving.
Mm-hmm. Perhaps I can add to that, Mavis. I was in the state of Victoria in Australia a couple of years ago at a traffic safety meeting on speed. The police chief officer there said, we're very proud of the fact that we now have 99% compliance with our speed efforts. So I had to ask him, 99% compliance? I'm from British Columbia. I can probably confidently say we have 99% non-compliance. And he said, well, all you need to do is you need to let people know it's happening. You need to catch them, and you need to hit them hard enough and let them know that their money is going back into more of this. Mm. So if they want less of it, comply.
Yeah.
Exactly.
Yeah. And I think one of the other things we'll hear about when Nick Ward is speaking about culture is we do seem to have changed the culture around drink driving somewhat. We've certainly changed the culture about wearing seatbelts, but we haven't even dented the culture in speeding because it's still fully acceptable by most people. And I was right. If there's no one else has, you haven't. Oh, yeah, Evelyn.
Yes, Mavis, thank you for saying that. I think that's the whole issue. The culture is not there for speeding. Certainly, when we go back to the early 1980s, the same was for impaired driving. The joke was, well, I couldn't walk home. I was too drunk to walk home, so I drove. So it was totally acceptable. Penalties were not very tough. And we really developed a systems approach to tackle it from an engineering perspective, a human factors perspective, the whole 9 yards, kids, adults, impaired drivers, developed programs for impaired drivers. We took a no-nonsense approach to really tackle it completely. It took a while for attitudes to change, but if you look at speeding, we have got the Fast and the Furious. You don't have movies to say the drunk and the drunker. driving, etc. So clearly it's not acceptable to drive impaired, to drive without seatbelts, etc. Completely acceptable and admired to drive fast, to drive super fast, street racing, stunt driving. It's here. Not everybody does it, but it's not considered to be a problem. That's what we think we have to do. A real systems approach, tackling it from every level. No nonsense, move forward.
One more, yeah, lady in the middle.
Thank you. My name is Emily. I'm relatively new to this field, but in response to this discussion, I think we're dealing with a greater challenge of a system and an economy that thrives on efficiency and speed. It's different than drunk driving. Like, it's different than seatbelts, right? Those are harms that happen because of errors, etc. But in terms of speeding, like, our economy relies on it. Like, time is money, right? There's so much of that embedded in our daily activities and our behaviors and the way systems are designed and structured, the way the built environment is designed. So we're really up against like a greater adversary with regards to the speed problem versus the other issues on the road. That's just my 2 cents.
I completely agree with you, because someone leaving the office to go and pick his kid to the kindergarten, something like that. So you might say, everyone has a reason why, oh, I don't speed generally, but today I was in a hurry. So I don't know. It's a good excuse, but it's true that we are fighting against more like social construct than just the speed to the city. Yeah.
But I think we also need some education, because there's a myth of how much time you save when you go another 5-10 kilometers an hour. I mean, we've all done it in the city, right? There's some guy, Yahoo, drives by you. Well, he stops and you're stopped at the same light. And all the way you end up after half an hour, you're still neck and neck at the downtown place where you're supposed to be. The highway, they have done estimates, they have done tracking. It's not much of an increase in terms of the time you save. And I think we also need to have some public education on that too. You don't save a whole lot more time by going 80 versus going 60 or 70.
Yeah.
So on all levels, I think there seems to be the myth. Yes, I realize that people think in terms of efficiencies, time is money, but in terms of commerce, we have governors on all of our transport trucks. So the efficiency is not around our trade and commerce. It's around typically individuals just feeling that they want to go fast, they can go fast. And if you drive along major highways, you see what I call these yahoos, that it's the thrill of just kind of cutting in. You see people braking all the time because they're cutting in. It's part of the game. And I think that's part of the culture we have to get rid of too. It's not just time is money, but also the fact that for a lot of people, it's sort of the thrill of it. If they want to do it, go down to the drag strip. Make it $20 a pop for them to take their car down the drag strip. And I think that could be one way to do it. But we have to get rid of that thrill of driving fast for the sake of driving fast.
We've got somebody over there, got a hand up.
Just a quick add to that. If time is money, it'd be interesting to see the cost of gas versus speeding and see the relation.
I agree 100% of what was just said, about on both levels. Is we definitely need more education and more resources to kind of prove the myth versus the facts, right? On how much gas that it actually costs to speed. Let's hit them in the pocketbook. Let's show them that. The signs on the side of the highway that say, if you're driving X amount of kilometers over the limit, this is what it's going to cost you. That's the campaign we need to get out there. Again, to change the culture as to, does it really save you any money in the long run? Does it even save you any time? It took me almost 5 hours to come here today. And, it's kind of beat the GPS time as to what, what they say. And it really does not pay. You don't get anywhere any faster.
But it's interesting, they used to say, if you speed, you're going to be caught. But due to reduced numbers of traffic enforcement officers, the likelihood of being caught for speeding by a traffic officer is actually quite small. And that's why we need to stress for more automated speed enforcement cameras, where we can certainly have a much greater impact. And one of the, we haven't talked about in this session, but somebody brought it up, I think, at one of the initial presentations, was about, you know, the role of the vehicle manufacturers. In Europe now and in Britain this year in 2022, all new vehicles have to have adaptive speed control. And so, you know, all these people that can afford to buy a new car are going to have one that's going to limit the speed on the roads. And those are the sorts of things as well. Look at the impact that alcohol, the in-vehicle testing units for alcohol have had, you know, on impaired drivers. You know, you're either, if you're drunk and driving, then you've got to pass this test before you drive the car. So if you're, you know, an inveterate speeder, then perhaps every time you turn on, then your car won't go faster than 40 kilometers an hour or something. But I'm sure in this day and age, they can't come up with some unique safety features in vehicles that could do more to make cars drive slower. And it's not first waiting all for autonomous vehicles, because I'm not sure that's the answer totally either. We have another question. This is wonderful.
Yeah, I think we have time.
Yeah,
The
we
break
do.
is until 3. Just to expand the discussion a little bit, speed limits. Ontario has increased the speed limits from 100 to 110 on a number of 400 highways, certainly around Ottawa. There's the part going to Montreal, and then the part coming up towards North Bay has been increased. What's the rationale behind that? I know there was a pilot study done on those road segments by MTO. I've never seen the results of that. I don't know if anybody has. Certainly the experience in BC when they increased the speed limits there was tragic. So the government had to reduce the speed limits again. So I don't know why Ontario decided to do that. If anybody has some thoughts on that, I'd like to hear it.
Again, in BC, that study was kept under wraps, because when it was first released, the government didn't want anybody to know about it. No, and then there was change because the speed limits were reduced to where they were. Anybody from MTO here that wants to take a stab at that? Hello, Deputy Minister. Well, I've really enjoyed this. I've enjoyed our presentations. I've enjoyed the fact that we had some time to have a, you know, more of a conversation, and we don't go into our break and until 3, and then a short break before the next sessions. Before we close, I'd like to point you in the direction of a new document on the World Bank Global Road Safety Facility website. I was on the team that have just developed a speed management hub, and you can go into the speed Global Road Safety Facility, and in there you can find everything you ever wanted to know about speed management and was afraid to ask. There were 5 different consultants worked on this project over 2 years, all from a different background, different countries. And so it's a very rich resource, and hope you'll follow it up. I'd like to thank our speakers, and in lieu of a gift, I'd like to give you these donation cards, which is a contribution to our Young Professionals Committee at CARS. And thank you for the time and effort that you're putting into your work. And I wish you all very good results in the research that many of you are engaged in, so that practitioners like me can take the good work that you do and make it work. So I thank you very much for your participation today. Thank you.
Just a note, we will be breaking until about 3:15, and you can make your way to the solarium where the trade show is set up, and there are refreshments there as well.